Hello, everyone. I'm Camellia, a psychiatric mental health nurse practitioner, also known as a PMHNP. I'm also a nursing and mental health enthusiast. And I just wanted to get on here briefly today to talk about something that's sort of this hot topic right now, and that is telehealth, or working as a provider or a PMHNP in telehealth. Just wanted to share a little bit of sort of insight here, pros and cons, maybe from a patient provider perspective, and just kind of let you guys know what that looks like if you're looking for a telehealth job, if you're wondering what it's like, and if you're wondering sort of what the experience of myself and others potentially has been working as a provider, particularly a PMHNP in telehealth. So do want to talk a little bit about that today. Just if you're new to this channel, just wanted to welcome you. Thank you for watching. Thank you for subscribing. I know a few of you have recently subscribed. And just a little bit about my background in terms of where I've worked and the places that I've worked. I have worked in the emergency room. I've worked outpatient, private practice, and for the last a little over a year or so, I'm working in telehealth. So just wanted to share a little bit of experience as a PMHNP, what that looks like. The first thing is that there are lots of perks to telehealth from a patient perspective. So a lot of patients actually prefer, or they tell me that they prefer telehealth for various reasons. One is that they are able to be in their own environment. A lot of patients tell me that it's convenient. They're able to pop on when they need to. But there are benefits for you as the provider as well when the patient is in their own environment. And what that looks like and could look like is that, the patient feels more comfortable with being able to be their authentic selves, and they're able to share things that they maybe would feel less comfortable sharing, or they're less anxious about kind of meeting you or just kind of going through the visit. So I do think that's a positive for both the patient, but also for the provider, because of what you're able to maybe get from the patient when they're in their own environment. I mentioned the fact that it's convenient for a lot of patients. The real stipulation there is that you have to be able to identify where the patient is located. So why is that important? Because we all have licensure in particular states. So when we are seeing a patient in most organizations, most of the regulations for telehealth, you have to know where the patient is located, and they have to be within state lines of the state that you are actually licensed. So that is something that comes up. You also want to make sure the patient is safe, and you want to screen for other things such as that. I've had a lot of patients try to drive and have their appointments. That is definitely prohibited for safety reasons. But you just have to be able to kind of get a good idea of where they are, if they're in a safe place, if they're in a place that they are comfortable sharing information, if they're not at home. Also, there are a few patients that this telehealth platform does not work for. The first is that some patients just prefer the traditional route, and we have to accept that. That's what patients have been used to, and we just have to accept that everyone is not going to appreciate or prefer the telehealth route for their care. The other thing about this is that when I say that it's not for every patient, it doesn't work well for patients that are not quite as savvy from the tech side. Of course, a lot more people are getting sort of groomed to that and understanding what technology is and what it looks like. However, it doesn't work for everyone from that perspective either. Lastly, and probably most importantly, it does not work for the acute, chronic, severe cases. And I say that because most organizations do actually have hard policies around who you can see or who you should be referring out or referring to an in-person provider. That is usually it's left to your discretion. So you want to be able to make sure that you're doing an appropriate screening, appropriate assessment and evaluation of the patient, so that you can get an idea or an indication as to whether this patient is going to be safe, whether they're going to be able to maintain stability by having a telehealth provider. There are some cases where we need to have that patient based on their history, the acuity, psychosis, severe states, that we need to have them see someone in person. Okay, so don't dismiss that, because telehealth is an opportunity, and it has been a growing opportunity for patients and for providers. Don't dismiss that there's still the traditional route that may work better for some patients. Okay. Now let's talk about things from the provider side. I've shared a little bit about how there is a benefit for patients being in their own environment. You may be able to get more from them. They may feel more comfortable sharing things with you that they normally would not feel comfortable, particularly on a first visit. But also, one of the challenges that I have come across is that it's very difficult, and it can be more challenging to read body language for patients. I've referenced this in a lot of my videos before, that patients, when we are communicating with patients, a lot of what we get from them is their body language. And it really can help you to ask more questions, or it can help you to kind of see how patients are receiving information. And so that's a piece of it in terms of your assessment that could be more challenged. It's not impossible, but it could be more challenged because you don't have sort of that full visual of the patient when you're looking at someone on the computer. Okay, so body language is a really important aspect of what we do as PMHNPs. And so I just like to highlight that, sometimes it's a little more challenging to be able to read body language from patients when you're seeing them by telehealth. Also, from that end of things, performing particular exams, such as the AIMS, where you would be looking for a response to the antipsychotic medications, or doing things like blood pressures. The real drawback there is that sometimes those things are they're driven by what you tell the patient to do, versus being able to be in the office and having the patient to have that done, or for you to be able to guide them a little bit more directly. So just understand that there are aspects of it that can be a little bit more fragmented. Fortunately, lots of organizations are looking at ways and have figured out ways to really make this process very similar and comparable to a traditional visit. But just keep in mind that there are times where you may come across things that are much more challenging to perform to be able to get what you need to care for the patient. Okay. And that also, ties into when I've talked about patients that are not tech savvy. There, of course, are technical challenges that can come up for you as a provider. So, you really want to make sure you have a backup plan and that you're not inconveniencing the patient in any way because of your own technical challenges. Now, of course, things happen, but you really want to have a secure process in place, a backup plan, so that if something does happen with your technology, you're able to continue to care for patients and you're not offsetting patients too much. Okay. A few other pros I've talked about, patients being in their own environments, but I would say personally, from a provider perspective, this work-life integration that we're all trying to achieve, for me personally, working by telehealth has been amazing. It's been great for this season of life that I'm in currently. And what that helps me to do is be able to continue doing the work that I love, but also be able to entertain and also, provide care in other aspects of my life, including self-care, including family life, and just being able to tap into those other things that are just as important or sometimes even more important. And just from a big picture perspective. What does that do for me and what can it do for you is that it provides you with job satisfaction. It provides you with fulfillment. You're more motivated to continue doing and serving others when you have sort of this integration and this balance. Now, the other side of that is that the boundaries have to be more firm. And I've figured this out on my own, just working over this last year and a half, that boundaries have to be set around work, particularly if you're working from home. You have to have boundaries set in place so that you're not checking in at 10 o'clock at night with work-related things, and you're able to really, have stringent time frames around when are you going to be working, when are you going to shut things down. And so, of course, that feeds into your work-life integration as well. So on the other side of that, setting those boundaries can be very, very important, or probably more important when you're working by telehealth. That's all I have to share with you guys today. Hopefully this gives you sort of a general idea of the patient side of things and the provider side of things as a telehealth provider. Of course, there are so many opportunities as a PMHNP for working by telehealth. So, these opportunities are becoming more and more normal, and they're becoming a lot just more vast opportunities out there. So I would say, if you guys have other questions about it, I may do a video just talking about kind of what my day looks like as a telehealth provider. But if you have questions, if you're sort of navigating the possibility or the idea of being a telehealth provider, definitely message me in the About section. There's lots of ways to contact me there. Also, of course, comment at the bottom of this video or anything else that you guys want to share. I love hearing from you guys. I love responding to you guys. You guys always have great questions. So keep those coming. And I will try my best to continue doing these videos as often as I can, just to share my real-time experiences. Thank you.